So this is the terminology we're going to use. You have an indicator segment, which is also known as the moving arm, which is also known as the distal arm or the distal segment, depending on your resources. You can use those terms interchangeably. We tend to, in this class, default to indicator segment. But if you say moving arm, we'll know what you're talking about. The reference arm, also known as the stationary arm, proximal segment, or proximal arm. And then there's the axis of rotation. So here are just some examples of elbow flexion. We're going to do this in lab this week. So the big take home with measuring range of motion is you have to have parallel lines. The arms of your goniometer have to be parallel to the segments that you're measuring. That is number one. Like number one, always for it to be an accurate measurement, your arms have to be parallel. Now, if you're having a hard time or you're not confident that your arms of your goni are parallel, what could you do?
Ask for help.
Use
No.
anatomical landmarks.
No. What's that?
I said use anatomical landmarks.
You can use anatomical landmarks, absolutely. So let's take this example here, knee flexion. So I say it's as easy as 10th grade geometry, but it's not. Not quite as easy. There's anatomical variability. There's soft tissue. You need to be able to visualize the midline of a long axis of a bone through, which can become difficult. So your default can be identify some of these anatomical landmarks to make sure that you're lined up in parallel with the segment that you're measuring. So if we're measuring knee flexion, I obviously need to have one arm of my goni lined up with the thigh or the midline of the femur. How do I know that I'm lined up with the midline of the femur? What's an anatomical landmark I can use? Yeah, I can find the greater trochanter and make sure the distal end of the goni is lined up. Now I want to line up my indicator arm. Leg there isn't quite as much soft tissue bulk, but you still might want to find an anatomical landmark just to confirm that you're aligned. What would that be? Yeah, you can use the lateral malleolus. So in your Norkin book, they've got different anatomical landmarks that you can refer to. We're not going to ask you to memorize all 3 anatomical landmarks for every single measurement that you're taking, but beware that if you go to take a range of motion measurement and your arms look wonky and they don't look parallel, guess what the first thing I'm going to ask you is? What anatomical landmark could you use to help align that arm of the goni? So I'm going to throw it back in your lap and say if it's a larger segment, if you're practicing with your expert groups and your home groups and you're having a hard time aligning it, then you probably ought to know these anatomical landmarks to make sure that you're lining up the goniometer arms parallel. Axis of rotation, parallel lines is like, big, blue, bold. Axis is like tiny, small, much less important compared to parallel lines. So that's the third point is going to be the axis, but all sorts of issues with that. You can be close, but I don't care if you memorize the axis of rotation because it is the least important landmark. Anatomical joints are not like a hinge joint on your door to your bedroom. There's not a fixed point. And this is a nice image to show that as you extend the knee, so here's your femur. I don't have to say that. You know what a femur is. There's your patella. There's your leg, your tibia. So you can see as the knee extends, they call it an instantaneous axis of rotation. So the axis of rotation is constantly moving. So why am I going to spend my time and energy finding the lateral femoral epicondyle when as soon as you begin to move, it's going to shift away from that axis anyway. So as long as you're ballpark close, I don't care that you know the axis, but I do care that both lines on your goni are parallel with the segments, because if you're not, it's not going to be an accurate measurement. And even Norkin is like, yeah, we give you all they call them fulcrums, but it's the axis or the vertex. Yeah, we give you all those, but it's the least important of those 3 landmarks for taking range of motion measurements.